We welcome back to the program the founder of Health Watch USA, Dr. Kevin Kavanagh. Dr. Kavanagh, good morning.
Good morning, sir.
Governor yesterday instituting a mostly mandatory mask order for the next 30 days in Kentucky. I assume you're supportive of that.
Yes, sir, definitely. This is something that I think needs to be done, and I should add there's a number of Republican governors, including Larry Hogan, Governor Charlie Baker in Massachusetts, and the governor of Texas that have also implemented similar mask orders.
All right, we just got a text here, and it's I understand the point. The attitude is pretending that we have already said something about it, but I'm going to bring this up anyway, just because it needs to be said again. We've said it all throughout all this, that there are some people who do have some issues, real medical issues with masks, and the text says, please consider the fact that there are some people who cannot wear a mask. There are many disabilities and underlying conditions which prevent people from wearing a mask, including anxiety, depression, PTSD, autism, skin conditions, and respiratory conditions. Please stop lumping everybody in one group and demanding that they follow the mask rule. You would not demand that somebody in a wheelchair stand up. Why would you demand that somebody with a disability that you cannot see comply with the mask rule? Please use some consideration instead of accepting things that you are told to do just because you are told to do them. Got a response to that?
Well, I do believe that there's a medical exemption. You also should realize that these are surgical masks, a cloth mask. They're not the N95s. N95s can be hard to breathe out of. But if you are not able to breathe out of a cloth mask, then you probably do not have the lung function that you should be around in public. Because if you got COVID-19, you would be extremely ill, and your chances of having a severe outcome are quite high. So if you're that sick with lung function, you should be sheltering at home. So these are the things that you have to do. And if you are claustrophobic, again, you're going to, I think, have to get a doctor's opinion on whether or not you should try to wear a mask or not. But if you're scared enough about wearing the mask, I would be even more scared of not wearing the mask, because the mask does offer you some protection. But again, remember, the main protection of that mask is to prevent you, if you're an asymptomatic carrier, from spreading it to others. And with masks alone, well, with combination, of course, social distancing and also hand hygiene, we can drive down this epidemic.
I want to ask you about a definition here, because we're starting to hear a term that we hadn't heard before. All through this, we have gotten used to the term asymptomatic. That's someone who has the virus but doesn't show any symptoms. Now we're hearing pre-symptomatic. What is that? How does it differ from someone who is asymptomatic?
Well, I mean, it kind of just muddles the whole narrative. It really does. It's quite difficult to explain to the public, because you don't know whether they're lumping everything together with asymptomatic, or you just use that in the normal term of, if you don't have symptoms, then you're asymptomatic. Medically or scientifically, there's two categories. One is pre-symptomatic. In other words, you're asymptomatic now, but you're going to develop symptoms in a few days. And then there is the asymptomatic category, where you just plain don't develop symptoms ever. You're just asymptomatic, your body gets rid of the infection in a couple weeks, you don't know that you have it. A lot of that is very confusing for the public, and it's just muddying the water, because more and more evidence is beginning to mount that, well, if you're asymptomatic and never develop symptoms, you may not have that high enough immunity to the virus to make a whole hill of beans in the next couple of months. You may just re-get it. So it really does muddy the water. And then that gets into what a case definition is. You know, what you need to really look at is, what are your chances of getting into the hospital? What are your chances of dying? And luckily, the latter is getting less and less as our treatments for this are getting better and better. So I guess I confused everybody.
Yeah, maybe so, but that's it's a part of all of this that we're all trying to learn as we go. And you and I have talked about this before, that we keep learning new things about the virus. We keep learning new things about the way that it behaves. And so what we know today may be different than what we knew a month ago.
Well, and that's correct. And that's why people shouldn't get that frustrated with science. Because remember, science started out with very little or no knowledge about this particular virus back in January. We had to relate it to what we knew with other viruses. And as they get knowledge, they're going to change guidance, but they're going to change guidance to the better as far as being more accurate. Unfortunately, the more we learn about the virus appears to be more and more of a deadly type of a virus or something we really do need to take seriously. So we do need to take the virus seriously. We need to wear masks. We need to follow good public health advice.
One of the things we've been seeing in the news lately is that as we have learned more about it, and as particularly those people, doctors and nurses on the front lines, have learned and treated people and learned from that, it sounds like the treatments haven't needed to be as severe for as many people as when we first were hearing about the number of people winding up on ventilators in ICUs.
Well, as the virus has shifted to the younger age group, you're going to have less people dying. You still have individuals that are getting into the hospital and into the ICUs. Now, with remdesivir, there's a new study just out that it shows it can drop your rates of death by over 60%. There's a lot of really good improvements here, and this is preventing people from getting onto ventilators, which is good. Even proning and knowing how to give proper pulmonary support has helped prevent people to get onto the ventilator. Because once you get onto the ventilator, even though that's needed, the ventilator itself can do damage. And of course, the virus itself can do damage. So anybody that has had to have respiratory support, such as oxygen, is at risk for pulmonary fibrosis and chronic breathing problems. And so I am very, very concerned that in the minds of the public, if you don't die, you're recovered and everything's fine, that's going to lead us to having a lot of people with long-term sequelae to this virus and chronic disability and medical problems. So we need to respect it. And is that going to happen to everyone? Well, of course not. The majority of people, it won't happen. But in a large enough percentage, even the young need to take this virus seriously.
Dr. Kevin Kavanagh, our guest on this portion of the program. Here's a texter that says mandatory masks will create wedges between government and citizens, but more importantly, between neighbors and communities. Small businesses will disappear and big box stores will be the only ones standing at the end of this.
Well, I'm not sure masks are going to do the transformation of the small box stores disappearing and only big box stores. I think the virus is doing that. You're going to see Amazon taking over. In fact, they already are. Their stock is just skyrocketing. Same thing with Costco and Walmart, with the big box stores, a curbside delivery. So that's something that I think is inevitable. The small box stores were under stress before this. And this virus is going to increase the transformation. The real thing I'm worried about is that we're going to see a huge availability of retail space and of office space to where that market may well crash. We're kind of seeing the beginnings of that with the Fayette Mall. My son works for a Fortune 500 software company, and he's working from home. Well, they recently told him that he's going to stay at home. Even when this goes away, they're not bringing people back. Their production's up. Their costs are down. They don't need to rent space. So you're going to have all this space that's not going to have rent coming in. The landlords aren't going to be able to make their payments, and we're going to have sort of a replay of the housing market. And that's one of the things I'm worried about, is we really do need to look at transformation. The loans, for example, that were given out to businesses, or even the payments that were given out by the government, well, let's say to pay your employees in the restaurant to keep them on your rolls for a couple months, would have been better spent transforming that restaurant more to an outdoor setting so you can have outdoor seating where it's safer. So we need to think about investing in transformation, because this virus is going to be with us for a while. One of the daycare centers was upset about the governor's mandates, was saying, well, if we do this for 9 months like we're told, we'll be out of business. I think 9 months is an optimistic outlook. That's if you have a working, effective vaccine and everybody takes it. We could be with this for the long haul. And there's other viruses which are appearing. There's even a report now of another virus appearing in Kazakhstan that the Chinese government's warning about, and people are saying, no, it's not deadly, don't worry about it. Of course, we've been through that dance before. So all of this is going to be here to stay. We need to figure out how to transform the way we live, transform our economy, rather than trying to deny that we're in a problem, doing stopgaps, hoping it's going to go back to the way it was. Because I don't think the virus is going to let us do that.
Dr. Kevin Kavanagh of Health Watch USA is our guest. Tell us about Health Watch USA.
Well, Health Watch USA is a nonprofit patient advocacy healthcare policy organization, and we were formed over a decade ago. We've been quite active in the public eye. In fact, next week, if you all want to find out what the experts in Europe and Singapore think about this pandemic that we're having around the globe, we're putting on a webinar. It's at healthconference.org, just www.healthconference.org, and you can register for that. So you can get an outside opinion that doesn't have the politics of the United States, which you think contaminates our decision making. So I think that we've been quite active in this.
In terms of the politics of it, the president the other day was talking about reopening schools and saying that the guidelines from the Centers for Disease Control he thought were pretty rough, a bit strict. And at first we heard that the CDC was going to be revisiting them, but then they said no, they would not.
That's correct. I think the CDC put a line in the sand. They also appeared to have backup from some other very prominent political Republicans who said, they're going to go with the CDC guidelines. The virus doesn't care about politics, and that's the problem. The schools are something that have to be done very, very carefully. The children do appear to be less likely to get a severe infection. We are not sure about if they're also less likely to transmit the infection, but there are children. They're who we protect the most. So even if there's a small chance of danger, parents want to mitigate that the best as they can. And in my opinion, in a disease that is as rapidly progressive as this, that we really do not fully understand it, we should side on the side of caution. And that, I think, is wise. That being said, I also think that the parents need to have the final voice, not the government, in how they want their child to be taken care of. And I would prefer schools to have multiple options for parents to choose, whether you want to have your child teleschooled at home versus having a blend program versus being in schools themselves. The older children, they could be teleschooled at home in most cases because they're old enough to be at home alone while their parents working. The younger children, not so much. Parents need to get back and get their jobs. So the younger children need to be in school where they are unfortunately less likely to obey public health standards. I mean, first thing my granddaughter would do is have a group hug, and that would defeat the 6 feet rule. So it's quite difficult. But there are strategies you can do, such as cohorting, maybe pool testing of the families to make sure that they're free of the virus. And if so, then the child could come to school. Cohorting is where you keep the group small, maybe keep them in groups of 10. And also you can even look at having maybe a staggered schedule during the day, or having two schedules of schooling, one in the morning, one in the evening. And it's also possible that if the... Oh, okay.
Cut you off like that, but we are out of time, and we thank you for being with us this morning, and thank everyone for being with us as well. Dr. Kevin Kavanagh, we got to get out of here. Sorry to cut you off like that, but we are out of time, and we thank you for being with us this morning.